Parliament's Health Committee wants the Department of Health to consider recouping money spent on treating foreign nationals at state facilities. DA Member of Parliament Michele Clark has suggested the matter be raised in the South African development community for governments to carry the costs. While Michele Clark joins me now to tell us more. Michele, good to have you on the program this afternoon. Firstly, what is the rationale behind the Health Committee's call for the government to recoup costs which are spent on treating foreign nationals in state facilities?
Good afternoon, and thank you for having me on your show. So, when discussing this matter and considering the state healthcare is in, and the massive burden we have in terms of trying to treat patients and giving quality healthcare, which has become a huge strain on public hospitals, number one, and number two, we are experiencing budget cuts year on year, which now increasingly is making it even more difficult in order to ensure that there's quality healthcare within public state facilities. And we read these horror stories every day. So the discussion was really around, in terms of the Constitution, Section 27 of the Constitution, South Africa must provide every person with healthcare that comes to state hospitals, and we agree 100% with that. But what we do feel is that there are many cases where neighbouring countries' doctors would refer patients to our state hospital facilities and then go back to neighbouring countries. And we believe in the Health Committee during the discussion that there should be some discussion with the Minister and the President on a SADC forum to see if there is a process that can be implemented that when patients are treated in our hospitals, that we are able to recoup the costs from that said government. And that was the discussion at the Health Committee portfolio last week in terms of this issue.
Can you elaborate a bit more on how the treatment of foreign nationals is affecting the overall service delivery in South Africa's public health system?
Well, I think at this stage, the system is extremely overburdened, full stop. It's just not coping even with South African citizens as well. So if there is a way that we could recuperate costs from neighbouring countries in terms of our budget cuts that we are seeing in healthcare, that would immensely help the strain public healthcare hospitals are facing at the moment in terms of shortages of staff, shortages of equipment, infrastructure, and many more issues that we are faced with within state healthcare at the moment.
Michele, given that the Department of Health has not budgeted for the treatment of foreign nationals, what specific financial implications does this have for the healthcare system?
Well, I think let's be frank, the budgets are cut year on year, even if there is no budget for foreign nationals, because the government at this stage is in a very big economic decline. We see this within the country at the moment, and of course, there are a lot of processes being put in place to try and recover the economic status of South Africa. But we are in a very tight squeeze economically at the moment. And, when we do not budget for specific items in terms of treatment, which in this case and you feel very sorry for people that need healthcare and they're not able to afford it. So, we must assist people. We can't not assist people, but there must be a way that government can go into discussions and the Minister and the President have those vetoed powers and discuss at SADC how we would deal with this approach. So that is a concerning factor, because the huge budget cuts that we are seeing and that hospitals are really not coping at the moment. And I can assure you, NHI at this stage is going to ratify this problem, because we have to fix our hospitals first before we can even think of implementing NHI, because our hospitals are not in line with the ideal clinic specifications in terms of NHI. At this stage, a very few percentage, is in line with that. So we need a mass budget in order to fix our hospitals first before we can even supply what we would like to say, not universal healthcare, but quality universal healthcare to everybody. So that is our concern, and we believe that the minister and the president should go into some form of negotiation with SADC, and it is a political issue, and there must be a political will to do that.
Let's explore an issue you just touched on a short while ago. How do we reconcile the ethical obligation, if you will, to treat all individuals, regardless of nationality, with the financial strain this places on state resources?
Well, I can tell you our hospitals are really buckling at the moment. And our doctors have taken the Hippocratical oath, and our constitution prescribes, in terms of what we need to do. And I'd like to think that we all are constitutionalists and believe in our constitution and cannot err from that. And therefore, we do have to assist every person that walks through that door, in terms of emergencies. I mean, it is what we have to do. But, we can see the strain that hospitals are being placed under because of our severe budget cuts at the moment. And just to mention, I mean, the OHSC that is supposed to, make sure that all our hospitals are compliant and have got what they need to do in order to give quality health care and make sure that primary health is exercised as number one within our health care. They are just not able to do what they are mandated to do because they themselves have got huge budget constraints and just don't have the capacity in order to assist, in order to make sure that hospitals actually comply in order to supply these services as well. So, it's a vicious circle at the moment that we're facing in healthcare, and very sad at the moment. And really, I think if we look at our medical legal claims and accruals in terms of healthcare, and if we can start getting rid of all that and cutting all the waste, then I think we can build on a far more professionalized healthcare to assist all patients with their healthcare needs.
Michele, let's discuss the how. What steps do you propose for raising this issue within SADC, and how might regional cooperation help alleviate some of these challenges that we speak of?
Well, it would be up to the health minister and the president to do that, as that is their powers of negotiation with neighboring countries. And, certain discussions need to be brought to the table. And then, obviously, legislation needs to play a role in terms of enforcing what decisions were made during these negotiations. So it's really up to that body to make sure that we do that. I mean, if I go overseas and I land up in a hospital, I have to, if I travel, I must ensure I have medical insurance. Now, I'm fortunate that I'm able to do that, but not everybody, is able to have that kind of cover. But certainly, if doctors are referring patients from neighboring countries simply for health reasons, health treatment reasons, and patients are then returning to their neighboring countries, there must be some process that we can claim the cost of the treatment of that patient from our neighboring countries where patients have been sent to our hospitals.
But more broadly, what policies do you believe should be implemented regarding the treatment of undocumented foreign nationals to really ensure fair access to healthcare while also protecting state resources?
Well, I think the policy that we need to be looking at is, as I said before, it's making sure that we are able to recoup the costs that we incur. Because if a foreign national lands up at a state hospital for an emergency, you cannot turn that person away. You've got to treat that person. You know, that is what we have to do. We cannot turn people away that need emergency medical treatment. I mean, that for me is totally unethical, and therefore there must be a change in the process in the way we go forward in claiming back treatment from our neighboring countries.
Michele, thank you so much for your time. That's DA MP Michele Clark sharing her insights on the Health Committee's proposal regarding the treatment of foreign nationals in South Africa's state facilities. She's been giving us the party's perspective on this issue.